How about like IPT, insulin potentiation therapy?
We're working on that. The only way that it really works is when you bring the patient into insulin shock.
Well, let's just go back and explain. The premise is that cancer feeds on sugar.
Yes.
So we want people that
and
lower
you
sugar in their
take
diet.
all of the sugar out. But in order to affect the tumor, you have to bring the patient into shock. And so the therapy, the patient is in intensive care. It's complicated patients. Usually cancer patients are in very poor condition.
And I can't do that.
It's just too extreme.
It's too hard on the body.
Yeah.
Then. What about immune stimulation therapy? What is that?
Immune stimulation for us is the most important factor of our therapy because all cancer patients have been are compromised. Their immune system is compromised. And so the only way that you can maintain a patient alive for a long time is through immune stimulation. And that is the biggest failure for chemotherapy and radiation therapy. They're very immune suppressant. So we stimulate their immune systems through music, through laughter, through color, through prayer, through nutrition. All of them combined, it's our immune stimulation therapy.
Wow. Is that why a person can fight cancer better if they're in like around their family, if they have people to encourage them, if they have...
There's a study that shows why children, for instance, they can consume dirt and do all of these things and never get sick. And the reason was because they laugh 400 times a day. An adult, it's about 30 times a day.
Yeah, I've heard even 18. The average adult laughs about 18 times a day.
With the stock market, I'm down to about 1.2. So
you should laugh about that as well.
Tough times.
Because if not, your immune system is going to be depressed.
Welcome back to Balanced Health. Today we're talking with Dr. Francisco Contreras about his book, Hope, Medicine, and Healing. And speaking of his book, Dr. Contreras has made a very generous offer. He says that anyone watching this program, watching Balanced Health, can either call the number that you're given quite often during the show, or you can go on our website and request Dr. Contreras' book, and you will receive a book as soon as it is available. They're just hot off the presses, so there might be a little delay there, but we encourage you to do that. You go for it.
How much do you have to pay for it, Shirley?
$0.
Absolutely free. That's
Absolutely free.
Offer.
Of course, if you want to contribute to TLN, we would always appreciate that. But Dr. Contreras is making those a gift to TLN to provide to you, so that's very kind. We appreciate that very much.
Well, I think that shows the heart of you and the heart of your ministry.
Yes.
So, going back to some of the various treatments that you offer at your hospital, signal transduction therapy. Now that sounds like it could be really effective or really out there.
It is very effective, and it's based on the fact that finally we're finding out why the cell does what it does. Even the most staunch evolutionists hated to say this, but they called it cellular intelligence because nobody knew why the cell did what it did, when it did it, and at how much. It's an incredibly complicated thing.
God had to create that.
Exactly.
It's just amazing.
There's no evolution. But what happens is that the genes have information that will send the cell on a pathway to get to where it needs to do, the production of things that they need to do. And that pathway is controlled by signals. What we have found is that those signals are triggered or manipulated with nutrients. Specific nutrients. And what we now know are very specific pathways for the malignant cell. Transduction means changing the signal to derail the malignant cell. And there are very specific nutrients in certain amounts that we can do that.
Here's a couple examples.
Yeah.
For instance, curcumin.
Ayurvedics uses a lot of curcumin for cancer treatment.
Yes.
What is curcumin?
Curcumin is a spice that you use to...
Like cumin? Like cumin? We call
Yes.
It? Yeah. Oh, sure.
And,
I use it in my chili.
Exactly.
My chicken chili, yes.
And so that will derail the malignant cell and make it more sensitive to chemotherapy, for instance. Or if you give sufficient, it will kill it.
How much of that cumin would you have to ingest to really help?
Well, in order to do that, the dosages are quite high, not what you get in
Sprinkling
in foods.
into my chili.
But all of these things are coming out, and drugs cannot do it.
Fascinating.
Only nutrients. And that is why when we looked at our results over long periods of time with the changes in the therapy, the common denominator of the patients that do well are the ones that stick to their diet.
Wow.
Because for maintenance, dietary supplementation is more than sufficient.
Well, we talk a lot about supplementing around here, and this is yet another reason why it is so critical to prevent and also to even to treat cancer. That's fascinating.
Well, some of these alternative treatments that we're talking about, Shirley and Dr. Contreras, I think it's worth mentioning to our viewers that whether you think curcumin is going to change that signal or not, whether you kind of believe us or not, this is one of those things where what is the downside?
Yeah, what
no
have you got to lose?
You know, and so many of these, that's what I always kind of amazes me at the amount of, you know, antagonists that we'll see against some of these things. It's like, okay, but if it doesn't work, what have you lost?
Exactly.
You know, you have a little more curcumin than you had the day before, you know, whereas if some of these other things are so much more traumatic and invasive.
And now it's been proven, okay? It's not whether you believe me or not. It's been proven.
I do believe you, but first do no harm, right?
Yes.
First do no interesting. Well, your new book is called Hope, Medicine, and Healing. Thank you so much for being with us. This has been so interesting, fascinating. Please come back and be with us again.
I will.
Whenever you're in our area. This has been just great and so much good information. Well, for more information on the book, Hope, Medicine, and Healing by Dr. Contreras, go to TLN.com, click on shows, and then click on Balanced Health. It's all the time we have. We hope you've enjoyed this show and learned something. If you'd like to make a donation or order a DVD copy of the show, give us a call right now. To submit your health questions, email us at balancedhealth@TLN.com, and we'll be happy to answer them on the air for you. And don't forget, if you want a copy of the book free, contact us and request it. Thanks for joining us. We'll see you next time right here on Balanced Health.